So how fortunate of some of these victims to be able to walk away and make a full recovery?
Yeah, so definitely very fortunate. Dr. Amundsen is our oral maxillofacial surgeon, so I'll let her speak a little bit more without going into details related to that.
I'm sorry, what kind of question do you have about?
How fortunate are some of these victims to walk away being able to make a full recovery, even though they received wounds to the face and the torso?
Yeah, fortunate. I mean, we treat a lot of these types of injuries here, actually, ballistic injuries in particular. And so the course is generally protracted several months, but we always return them to full function at the end.
We've got time for 2 more questions. We need to let them get back to work.
Members of the community, I mean, is there if they want to help, is there blood that's needed, or just want them to kind of help themselves?
No, I'd say at this point, the best thing for the community is, just support each other. We know that there's a lot of advocates out there. We know we have our chaplain services. We have a lot of services to kind of cope with what's just happened. So we don't need any sort of blood donations, although I always say go out and donate blood. But yeah, no, nothing like that.
The location of the hospital being so close to the university, kind of the time thing we all know is the most important, right? I mean, the people on the ground probably got it to this stage. You guys figure that all of it worked probably to your advantage by having it.
Yeah, absolutely. We are a level 2 trauma center, the only within a certain distance, in the Big Bend. So we know what role we play. Thankfully, we are towards the center of Tallahassee, very close to the university. So definitely helps in situations like this.
Dr. Howard, excuse me just a minute. Dr. Howard, can we let everybody go down the line and see if there's anything we left out that needs to be provided and kind of instruction before we finish?
Any comments from
I don't
anyone?
have any additional comments.
Where is the cause of death of people that pass away? The war?
Oh, we have no information on any of that. Yeah.
Just have a last timeline question. When would you say things were under control, or what sort of phrase would you use for that? From getting the first patient until things were
Within an hour. We had at least 2 patients in the operating room within an hour. We talk about time from patient arrival to getting CT scans. That was within an hour. So you talk about 6 patients. That's impressive.
Was there a victim treated for non-gunshot wounds?
Not that I'm aware of.
Doctor, you talked about how fortunate some of these victims were. Could centimeters have made a difference for any of them?
Yeah, of course. Yeah, gunshot wounds, it can be a matter of inches or centimeters.
Obviously, this comes as there have been conversations about the hospital's future. Always Brown Tallahassee Democrat, so local reporter was very involved in these conversations. I want to know, if at all, how does this moment kind of factor into that discussion?
It doesn't at all. We function. We've been in partnership with this community, FSU, for a long time. We operate as so no factors whatsoever.
This incident happened on Holy Week. Easter's on Sunday. Just wondering how this will impact your Easter plans and what you're carrying into the weekend.
Just spend time with our families. That's the same thing for us. We certainly are used to this, but we're all here to support each other, and we'll just take it a day at a time.
Any other comments from our physicians? Anything we left out or important to share? Do any of our physicians speak Spanish? He has a specific Spanish language question.
Somebody could speak Spanish. I think this will be it, guys.
Thank you so much.
Thank you for what you did. Thank you for being so gracious.
Thank you.